At 8:24, Tommy Tucker, WWL. It is the Medicare annual enrollment period. If you have Medicare, now's the time to review your coverage options for 2025 and decide what's right for you. As I mentioned, Newell Norman's going to be out at the Medicare Center, the People's Health Medicare Center. That's next to Party City in Metairie on Vets. But right now, Mike Knight is with us from People's Health to explain the ABCs of Medicare. Hey, Mike, how are you?
Hey, Tommy, good morning. How you doing?
I'm all right, sir. Tell me about I hope you have everything ready for Newell, do you?
Oh, yeah. Okay. So I'll be seeing him in a little while.
But you got
shortly.
You got the writer, right, with the demands and all that?
They didn't give me that, but I'm sure they will.
Okay. You might want to go through that very clearly. No green M&Ms, certainly not. Anyway,
I was about to ask, is there anything about M&Ms in there?
No green M&M. You give Newell Norman a green M&M, look out. Let's talk about the annual enrollment period.
All right. Any certain question? Well, I mean, so annual enrollment, I mean, it's coming up to the end right now. You know, December 7th, which is this Saturday, is really the last time where people can make changes to their plans. So if somebody's interested in making a change, if they come by and see us, this is a great time to sit down and talk to somebody.
So if you have Medicare, is this the only time you can make changes?
For most people, generally, yes. And the annual enrollment period, or AEP, is the time to make changes. If you meet certain criteria, special enrollment periods are available, but that's going to be on a case-by-case basis. And things like if you move out of the area, if you lose cover from an employer, if you're aging in the middle of the year, those are times when you get those special elections.
How many parts of Medicare are there?
4 parts. You have with Medicare, you have Part A, Part B, Part C, and Part D, and each one of them covers a little bit different services, and each one of them has different costs to it.
Well, we could start with D, but that would make it more confusing. Let's start with Part A. What does that cover?
Okay, so Part A is going to cover things like if you're in a hospital or a skilled nursing facility. It'll also cover hospice care or certain home health services. Most people, they automatically get Part A when they turn 65 or if they go on disability Medicare. You know, if you and your spouse paid Medicare taxes for long enough, which is usually 10 years, you won't have a monthly premium for Part A, but doesn't mean your coverage is free. When you receive Part A services under original Medicare, you have an overnight stay in the hospital or something like that, you're going to have a deductible and a daily coinsurance. And these are set by Medicare, and they usually change every couple of years.
Man, I always hated that term coinsurance because you're paying that yourself. It would seem as though there's another insurance company involved, but there's not. You're paying that, right?
Correct, right, yes. And coinsurances can vary based on the total charge that you're receiving.
All right, let's talk about Medicare Part B. Mike, what is that?
So medicals, the Part B of Medicare is going to be what most people think about when they think of health insurance. It's if you go into doctors, if you get an outpatient care, if you're going to get flu shots or blood work or x-rays, even like medical equipment for wheelchairs, hospital beds, that type of thing.
All righty. What about Part C?
Part C is going to be, basically, they're called Medicare Advantage plans. They're private companies that have a contract with Medicare. You know, People's Health is one of those. And Medicare Advantage plans, we've got to follow all of Medicare's rules, cover all the services that original Medicare covers. But many of the plans offer extra benefits, like things like dental, vision, hearing, because, you know, we get the money from Medicare and we can do more with it. We can offer better services, which most people seem to like.
What is Medicare Part C?
Well, that Part C or Part D as in David?
Part D, I'm sorry, beg your pardon. Part D, that's what
Yeah, sure. So Part D is going to be your drug coverage. And with the drug coverage, that's going to be optional for everyone. So you don't have to sign up for drug coverage if you have it through an employer or something like that, if you're still working past the age of 65. You do have standalone drug plans. A lot of them, well, some of them will charge premiums. You can also get it through a Medicare Advantage plan like People's Health, and there is no premium for it.
And now let me get back to that with Part C. I just wanted to get D out of the way to talk about the different types of Medicare Advantage plans.
So, yeah, there's a bunch of different types, and they're generally going to have lower costs. Some will have in-network or out-of-network coverages for most services. And then, you know, for some of them, they'll only cover network providers. So you really want to look at the plan. If you have certain doctors you're going to, you definitely want to inquire about that, make sure that the physicians you want to see are covered or the facilities that you go to are covered. And then they also have additional plan options for people with both Medicare and Medicaid, or if you have certain chronic health conditions.
Yeah, let's talk about those chronic conditions because that's important.
So chronic conditions, things like diabetes or heart conditions, Medicare allows plans to establish special needs plans for them. They're called chronic special needs plans. And what they do, it's for long-lasting conditions like diabetes or heart failure. And these kind of plans, they have benefits that are designed to help members manage these conditions. And they may include low-cost specialists or extra help coordinating care with doctors.
So does People's Health offer chronic condition special needs plans, and how do you decide which one is right for you?
So we are, yeah. For 2025, we're going to have a chronic special needs plan that's going to be for people with chronic heart conditions, diabetes. And really what you want to do is you want to think about, do you have a chronic health condition? Is it something that you're going to have to manage long term? And could you use help managing that condition? And if the answers are yes, then just you need special needs plans could be a good option for you.
And that's new for this year from People's Health, right?
That's correct, right. Yeah, they're all due for 2025.
All right, Mike, I know Newell's going to be out there today from 10 until 1, and people can always go into the People's Health Medicare Center, 3017 Vets, is it, next to Party City? And
that's correct.
The special presentation at 1 o'clock today. Thank you, sir. Appreciate your time. Mike talking about different parts of Medicare. Newell's going to be there from 11 till 1, 3017 Vets, next to Party City in Metairie. Appointments are recommended. Walk-ins are welcome. They're going to have a big staff out there today as the day draw is near December 7th, the last day to register. So head on out there. They'll take as much time as you need with you to explain it to you, make sure you understand it. They got a presentation at 1 o'clock. People's Health Medicare 101 presentation. I'll tell you all about the new plan. Go to peopleshealth.com or call 1-800-978-9765. We'll talk to DA Jason Williams when we come back here on WWL.